We begin tonight continuing to monitor a measles outbreak in southwest Kansas. The Department of Health and Environment confirming cases have more than doubled since Friday.
So here's what we know. Take a look as the outbreak has spread to 3 more counties, Haskell, Kiowa, and Gray County. Stevens, Kiowa have the most cases with 6 each. Here's what we know about those cases and how they break down. The first 10 cases were in children. We do know 2 adults now have it. 20 of the 23 cases involve people who are not vaccinated. 1 considered under-vaccinated. 1 is vaccinated, fully vaccinated. The vaccination status unknown for the last person. The state says the cases have that possible link to outbreaks in Texas and New Mexico, but the source is still not certain. Meanwhile, Sedgwick County says it's preparing for the inevitable.
If there's a case in Kansas, then we always should prepare to see cases here in Sedgwick County. We've been preparing with partners. We've also had a measles clinic. So last Saturday on the 22nd, we had an MMR clinic, so measles, mumps, and rubella vaccine. And then we'll have another MMR clinic on April 5th.
As she just said, that clinic, April 5th from 10 a.m. to 2 o'clock at the Health Department on 9th Street. The clinic is walk-in only. You do need to bring your ID, vaccination records if you have them, and insurance information if you have insurance. Kansas also has launched a new measles outbreak dashboard that updates every Wednesday. Trust us as we will update you as we continue monitoring that outbreak.